G'day guys, Dr. James Simcock here from VetDojo. Just wanted to show you a quick video of a dog with bilateral elbow disease. It's an older dog, about 8 years old, and I just wanted to talk to you about what we're doing, which is a needle scope. So the needle arthroscopy is a really great way that I find to evaluate the joints and really to look at the cartilage health in these guys. And I use it a lot more for these older dogs with established arthritis. We've often done x-rays or CT imaging. You can see radiographic change of arthritis, but it doesn't tell me what is really going on with the cartilage health, and that can be quite important prognostically, and I think also with the treatment recommendations that I make. So the needle scope allows us to have a very quick look in the joint. It's a fibre optic camera. It's very, very small, about 1.2 millimetres. But the nice thing about it is we can see in here, we've got this section at the top here, full thickness cartilage loss on the humeral condyle. And looking over on the lateral condyle, everything looks pretty smooth. And in here on the ulnar, everything's looking pretty smooth. But if we come around and look down at the spino process, down here, we can actually see that there's full thickness cartilage loss there again. And then on the humeral condyle up here, we've also got more cartilage loss. So, interestingly, the opposite elbow, which is CT, was worse on the CT scan with the radiographic change, but there was still good cartilage health. On this elbow, the cartilage health is not as bad, and I think it's really important to recognise that there's not always a great correlation between what we see on x-rays and CT and the imaging compared to what we see on the scope, like we've done here. So we can't do much more with the needle scope in terms of treatment. I generally don't bother if I'm going to do any kind of fragment removal or anything like that. There's also probably loose coronary fragment there, which is probably less better than taking it out. If we had to do anything like that, fragment removal or intra-articular focal treatments, I'd actually take them into the operating room and do a full scope. So the advantage of the needle scope, it's very, very small. We can do it out of the treatment area, just a very light GA, very quick look, and just to have a look and see what the cartilage health is doing. So I'm doing that much more commonly now, especially when I'm going to follow up with stem cell, the biologic therapy, so stem cells and PRP. So just a quick video for today, and I hope that was interesting, and we'll see you all soon.